Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on the COVID-19 pandemic for Tennessee, Virginia, and the Appalachian Highlands. Now, as you know, we've been following the week-to-week growth rate in the United States, with it progressing down fairly nicely to 2.1% weekly growth rate. Virginia has been popping around a little bit, but now seems to be coming down to a similar level. So that's a good sign. It suggests that the pandemic in Virginia is starting to slow down. If you look at cases reported in Virginia, there was an early rise and it dropped and it came back up again. It seems to be level since then. I'm not a big fan of using cases because it's dependent on the number of tests that you do. But if you look at deaths, that's pretty illustrative. It's pretty hard to argue with deaths. And what you see here is this interesting pattern, what I call the bouncing ball. Quick rise, drop, rise again, rise, drop. And each rise seems to be a little less than the one before. And what this tells me is that the pandemic is spreading slowly throughout the state, hitting new population centers, and hopefully starting to slow down. Hopefully we're not going to see too many more bounces of the ball. If you look at all of the cases in Virginia, from the beginning, it was clearly in the peri-urban areas, but now in the past 2 weeks, you can see it evolving more into the rural areas. Tennessee, we've seen a similar drop in the growth rate, but not quite as much as Virginia, still growing about 6% in the past week. Again, if you look at cases, it's very slow rise, and then a fairly rapid increase and coming down. But again, cases dependent on tests. So if you look at deaths, you see this very slow but steady rise in the daily number of deaths and finally coming down over the last month or so. Just as we've seen in Virginia, just as we've seen in the United States, just as we've seen around the world, what we're seeing is an evolving pandemic that's spreading. So this is all of the cases in Virginia and Tennessee since the beginning, and then you can see now in purple and the dark counties are the new clusters, and you can see that it went from the peri-urban areas now into the rural areas. And while that's tough on those rural areas, it does suggest that we're moving towards being a mature pandemic and that we should see a slowing growth rate continue over time. If you look at the Appalachian Highlands, we see this dichotomy between the number of cases in blue and the hospitalizations in red. And again, we've talked about this before. It could be because the cases are sicker and they end up in the hospital, but I think it's simply because we're not doing as many tests. Hospitalizations, like deaths, don't lie. So that's really a measure of how the pandemic is doing in our region. In terms of confirmed cases in the Appalachian Highlands, we see a pattern very similar to Tennessee, such that we've now had 38,000 cases and about a 6.5% increase in the past week. If you look at deaths, again, a similar pattern to the state of Tennessee. And now we've passed 600 deaths, which is pretty significant, and a 4.5% increase in the past week. So again, we're looking for a drop down below 1% to really tell us that we're getting to a mature pandemic. Tennessee is not quite there. It seems to be moving in the right direction, but it's still at 6% a week. That's still pretty high if you think about it. In the Appalachian Highlands, our numbers go all around, but you can see we've sort of gone from the high 20s down to about 5%. So hopefully this pattern is going to continue both in the state and in the Appalachian Highlands, and we'll see a movement towards a mature pandemic. So again, we're in the midst of the pandemic right now in our region. This is certainly not the time to lighten up or change what we're doing. It's still the time to implement the things that we know make a difference. Wear a mask if you're around other people. Avoid people if you can. Social distance is both distance and time. Good hygiene, and avoid crowds. If we do those things, I'm pretty confident that we'll continue to see a movement towards a mature pandemic where our growth rate will be slowing down. So far, Tennessee's reported 150,000 cases and almost 2,000 deaths. Virginia has less cases because they're not testing as much, but more deaths. And our region's had 38,000 cases and 600 deaths. So again, a mature, evolving pandemic. We look forward to it slowing down, but it hasn't happened yet. Let's continue to take it seriously. There's a great deal more information about COVID-19 on the College of Public Health website. If you click this icon, you can see updates for the U.S. and the globe, as well as short videos on masks, social distancing, and so on. If you know anyone who'd like to be added to the website, please let Jan Stork know at this email address and this phone number. As always, thanks to Melissa White for updating this week's slides and Derry Young for editing, producing, and posting the videos. If you have any questions or comments, would like to see us cover any topics, please let me know. I look forward to hearing from you. Let me tell you, I will be out of town the next week, so if you email me, I may be delayed in getting back to you, but I'd still like to hear from you. Thank you very much.